This morning, the FDA and CDC announced that out of an abundance of caution, we're recommending a pause in the use of the Johnson & Johnson COVID-19 vaccine.
Together, the CDC and the FDA are reviewing data involving 6 reports of a rare type of blood clot called cerebral venous sinus thrombosis, or CVST, in combination with low levels of platelets in the blood, called thrombocytopenia, in women ages 18 to 48 who presented with symptoms between 6 and 13 days after receiving the Johnson & Johnson or Janssen COVID-19 vaccine. Treatment of this specific type of blood clot is different from typical treatments for other types of blood clots, which usually involve an anticoagulant called heparin. With cerebral venous sinus thrombosis, heparin may be dangerous, and alternative treatments need to be given, preferably under the guidance of physicians experienced in the treatment of blood clots. Of the clots seen in the United States, 1 case was fatal and 1 patient is in critical condition.
I know there are people who have gotten the vaccine who are probably very concerned. For people who got the vaccine more than a month ago, the risk to them is very low at this time. For people who recently got the vaccine within the last couple weeks, they should be aware to look for any symptoms. If you've received the vaccine and developed severe headache, abdominal pain, leg pain, or shortness of breath, you should contact your healthcare provider and seek medical treatment.
The issue here with these types of blood clots is that if one administers the standard treatments that we as doctors have learned to give for blood clots, one can actually cause tremendous harm, or the outcome can be fatal. Again, we're recommending a pause out of an abundance of caution, but on an individual basis, a provider and patient can make a determination whether or not to receive the vaccine.